Hi everyone, my name is Quentin Flint, and one thing that keeps me up at night as a nurse is patient autonomy. Specifically, who gets to make decisions when a patient's mental status is questioned. I've seen this happen in both my personal and work settings, and it never really sits right with me. In my personal experience, there was a time when my father was hospitalized, and I was told that I didn't have the right to his medical information or make medical decisions on his behalf, because he wasn't considered to be of sound mind to give consent. At the same time, he wasn't viewed as being capable of making his own decisions. As someone in this situation for the first time on the patient and family side of things, I felt more like I was in a jail cell rather than in a hospital. That experience was so frustrating and confusing for me, and it made me realize how these situations can fall under like a gray area. At work, I've seen this a number of times. I recently cared for a patient with a history of dementia. She was alert and oriented for me and clearly refusing surgery. Despite this, her husband, who was her power of attorney, insisted that the procedure still be done. This raised a huge ethical dilemma for me. This little old lady was in the room crying and pleading with her husband, but at the end of the day, the doctors were still going to do what the husband wanted. I wanted to do everything in my power to advocate for my patient. I even got case management and patient advocate involved. But the things that no one could look past at the end of the day were this diagnosis and a legal document completely dismissing what the patient's wishes were. Another situation that stays with me involved a patient who had been petitioned earlier on in his hospital stay. Sometime after the petition had expired and psych had signed off on him, he wanted to leave against medical advice. Even though no new petition had been made, there was a disagreement about whether he still had the right to make these decisions based on prior determination of his incapacity. These situations keep me up at night because they challenge the balance between protecting patients and respecting the right to make their own decisions. They've really reinforced for me how important advocacy, reflecting on ethics, and clear communication are in nursing. As a nurse, I want to be the one to make sure that patients' voices are heard and respected while still making sure that we're safe and following things how they should be done legally, even when the answers aren't clear. Thank you.